Good afternoon, and welcome to another webinar hosted by the Greenwich Hospital Medical Library. Today's webinar is What Do I Ask? Your Role in Healthcare. My name is Veronica Blanken, and I'm the Consumer Health Librarian at Greenwich Hospital. If you are not aware of me or what my job entails, a Consumer Health Librarian basically helps find and evaluate health information. Can be either in print form, but mostly in this day and age, it's online help with health information. And it's because that there's so much overwhelming amount of information thanks to the internet, and medical information especially is susceptible to misinformation, fraud, scams. And so I help people narrow down, find what they need, and help them make the best healthcare decisions possible as a result. And today I'm really excited to do this topic because one of my special area of interests is patient health, safety, and advocacy. And like any relationship, the doctor patient visit and relationship is an important aspect in a lot of our lives. And it requires the same elements, core values of any relationship: trust, healthy communication, honesty, and it requires work on both ends. But today's webinar will be on the patient end, basically what you can bring to your next doctor's visit. So before I begin, this is a disclaimer that I put on all of my presentations, that this presentation is for educational and informational purposes only. So the 2 points that I want to make clear is that you should always consult your doctor or other healthcare provider, HCP, for medical advice before making any lifestyle decisions that may impact your health. I am not clinically trained, so therefore always, while I will find the best health information for you, always consult it with someone who is clinically trained or licensed. So I will be recommending websites today from various health organizations, but none of them are paying me to promote them today. So that is why I also add that there is no sponsored content that will be featured during this presentation. Now that we have that out of the way, I basically set up this webinar to cover two objectives. The first is just to provide tips for preparing for your next doctor's visit. It's going to be very broad, very general, and then to provide a list of helpful patient advocacy resources so that if you're unable to attend today or unable to view this video in the future, you may definitely go in and search for yourself using these resources that I will share today. So I wanted to start off the presentation by giving some important statistics that I found that indicate that patient advocacy and I'm just bringing your all into the visit and preparing in advance is so much more important now than it's ever been. The first being, we're going to go all the way back to 2003 for this one. The key findings of the 2003 National Assessment of Adult Literacy, and we're specifically looking at the results for health literacy skills in U.S. adults. And it showed that over a third of U.S. adults, that's 77 million people, scored basic or below basic for health literacy skills. And these skills include difficulty adhering to prescription drug or immunization schedules, explaining the symptoms of a condition back to the doctor, being able to read a nutrition label, being able to pick an insurance plan and figure out the deductibles and such. Basically, all the health literacy skills that one needs in order to make the best healthcare decision possible. A lot of people did not score in the highest regard for that. And which is unfortunate considering that one of the ways to make a productive visit productive is to understand crystal clear what your doctor is telling you to do. This really shocked me, this next statistic, that medical errors, according to the National Patient Safety Foundation, are the third leading cause of death behind heart disease and cancer. So I did not expect just medical errors, essentially human error, to fall behind one of the most uh, deadly, two deadly diseases of our time. So, and it contributes to over 200,000 deaths every year in the U.S. It's a shocking statistic. It's a shocking number, and from all the resources that I've looked at, a lot of it has to do with being able to properly communicate your needs with the doctor and the doctor being able to communicate what they need from the patient. And the last statistic that I wanted to share was that doctor's visits have been steadily declining since 2015. And even more so, about 60% during the pandemic. That's a statistic that was given by a study by researchers at Harvard. Because of the pandemic, that makes it's obvious that, with everything being in quarantine, that private clinics and practices closed down. Unfortunately, a lot of layoffs occurred, so a lot of people's primary care doctors either don't or became unemployed or retired. I actually had that similar case myself. Um, so on this, of course, not only impacts the primary care physicians, but it also results in a lack of access to critical care and tests. Uh, there are a number of annual visits we need for, colonoscopy tests, blood tests. A lot of those people didn't get it this year when they were supposed to. And even when we try to reschedule, people have booked months, weeks in advance. So it's really hard to get that visit that you essentially need to take care of yourself in when things are we're all struggling in this pandemic right now to try and figure out how to just get back to normal, when being able to just set up an appointment is part of that obstacle. And so even before the pandemic, there were surveys such as this from Consumer Reports. Most common patient complaints for doctor's visits. This is a neat little visual screenshot that I was able to get from the 2013 Consumer Report, that the top highest rated patient complaint from this national survey was unclear explanation of the problem. And I'm assuming they mean the problem being the diagnosis during the visit. There were other communicated related complaints include test results not communicated fast, felt rushed during an office visit, side effects not fully explained. Just over half of these are, related to the doctor's visit and the communication or miscommunication, as you say, between the doctor and the patient. And we should really be looking at this feedback as a way to show improvements that could be made to the visit. And like I said, it's a two-way street. The doctor can definitely make improvements on their end. Patients can be more prepared ahead of time. And this is the last statistic. So I think the most anecdotally, I think we all know that an average time for a doctor's visit is usually 15 minutes. Seems a lot less lately, but according to the 2017 Medscape Physician Compensation Report, as you can see in the visual over on the left, overall primary care physicians spend 17 to 24 minutes with each patient, which seems a lot longer than you would think. And I couldn't get the Consumer Report for 2020. It's not open access, but I think we can all agree that this may be considered even less time now, with when you put into perspective wait times. Practitioners are under a lot more paperwork now, so actually a huge percentage of the visit will be just filling out the paperwork for the patient and less about the face time. The nature of the visit, such as the condition you're actually asking about, may impact the amount of time you have. And also with all the precautions that are being taken when you actually go into any institution now in person, well, with the temperature screenings and having to be socially distant, maybe even have to wait outside. I, in fact, had to wait outside for quite a bit, literally outside in the driveway of a clinic to get a COVID test. So it definitely would have not been as long had it not been for that precaution. So I'm sure we all have a story like that, though. But in the event that that's occurred, the primary care physician or visit has gone remote, and remote patient engagement has increased 225% in 2020. And that is why, knowing this time and also the aspects that would make that wait time even shorter, that's why it's even more important for patients to better prepare and bring as much info to their visit as possible. So before you even know exactly what to ask in a doctor's visit, it's helpful for you to figure out what kind of doctor you actually want to see. So the tip for getting started that I would recommend is, and most of the resources I've looked into say, before looking, you want to create a list for yourself of what qualities matter to you in a doctor. And according to my pamphlet here that I've got, a lot of the characteristics revolve around, if there's a language barrier, if you're more comfortable in one language over another, you want to get a doctor you're able to better communicate with more easily. Do you prefer a doctor who is part of a group practice or who's more of an individual? Some people prefer groups so that if that doctor is not available, they still have someone else trusted that they can see. Are they more available in the nighttime? Are you more available in the morning as opposed to night? So you want to be able to ensure that they're able to see you. What kind of treatment options are offered by them? Some people prefer someone who's just traditional medically trained. Other people prefer doctors with other specialties, or that they even offer complementary medicine or are well knowledged in that area as well. And I think we can all agree that rapport and bedside manner are really important. If you don't feel comfortable talking to this person just in general, I don't think you'll be comfortable just talking about very sensitive and private information such as health. There's also the qualification of age, sex, race, and religion, but that's obviously personal to everyone. So if that really matters to you, then definitely take those into account as well as qualities for a doctor. So these are the two resources that have been recommended for references when you want to check on the board certifications of healthcare providers in your area. So I'll just show you one of these. This is Doc Info. Just double click that. Sorry about that. Here it is. Oh, here we go. So Doc Info is right here. So this is what the website looks like. So information you trust you. Here you can verify a doctor's license and professional background. It's for physicians and physician assistants. I actually have a family member who is a physician assistant, so I'm going to use their name just as an example. So here you go. This is what comes up for my father. He shows you where he currently works, the education that he has, what his active licenses are, and it also would put down what kind of lawsuits or actions have been put against him if there ever was one. And luckily, there has not been so far anything against my father, so that's good. So Doc Info, really great resource for being able to verify that the doctor that you choose is board certified. And I would recommend that you pick more than just one doctor to look into, because you want to have a healthy variety or more options in case one or more doesn't work out. Next, we have Medline Plus. If you have tuned into my webinars before, I talk about Medline Plus a lot. It is one of my favorite databases. It is basically a search engine designed specifically for health information, and it is a subsection of the National Library of Medicine, the largest medical library in the world. It is one of the features that they have is that they provide directories for specific conditions, other healthcare providers, and specialized healthcare clinics. Just going to quickly show you what that looks like. So I always call Medline Plus, I almost said Netflix, Medline Plus, a gateway website, because you basically have a list of links that are very neatly and easily categorized. So as you can see, we have Doc Info, Online Doctor Finder. The Doc Info is what I just showed you. You click on here and it immediately takes you to the exact same site that I just showed. But as you can see, it also has find a health center, find specialists, other healthcare providers such as diabetes educators, physical therapists, doctors and clinics that are specialized, such as for Alzheimer's or for polio or for substance abuse. And then we also have other healthcare facility and services such as hospices, nursing homes, even foster care and adoption directories. And on the side of it, it'll tell you the organization that is associated with it. All of these have been peer reviewed. Everything on this site essentially has been peer reviewed. It's up to date, accurate. May have a broken link or two because, website management is difficult and sometimes websites crash. But feel free to look through these when you're definitely going through looking for a potential doctor to see. And I think this is pretty obvious to all of us, but I figured it was helpful to mention that make sure that whatever doctor that you choose, they accept your insurance, because no matter how great these people may be personality-wise or language-wise, you don't want to go bankrupt visiting them. So for information on health insurance plans, especially now when a lot of us may have been are currently unemployed or laid off and are no longer on our companies or jobs health insurance, these sites, usa.gov and healthcare.gov, they give you all the information that you could need about all types of healthcare that is available, including COBRA, including Medicaid, Medicare, etc. Really great sources. So physically preparing for the visits, getting ready. You found the right doctor, you've made the appointments, you want to prepare ahead of time for it, so that, remember, you have maybe less than 17 to 24 minutes. First thing you want to do is create another list. And this list will be of the concerns you would like to address with your doctor. Do you have a new symptom you want to ask the doctor about? Do you want to get a flu shot? Are you concerned about how a treatment is affecting your daily life? If you can't think of a question right off the top of your head, or just want to narrow it down to like 3 or 4 main ones, there is a really helpful tool called the AHRQ Question Builder. It's a website or mobile app, so you got 2 options there for how to access it. I think it came up. I'm just not seeing it. Yeah. So let me just exit out of this and try again. This way. Yeah, here we go. Now it's working. So AHRQ stands for the Agency for Healthcare Research and Quality. It's also one of the resources that I use primarily to create this webinar, where I got most of my tips from. This is what the question builder looks like. So it says, create a list of questions that you can take, whether you're getting a checkup, talking about a problem, health condition, getting a prescription, discussing a medical test. It basically starts from the bottom and goes up to more specifics. They want to start off by asking exactly what you want to talk about, aka what kind of appointment you need. So from then it would go into more specifics, but it's really handy in case you don't know where to start. So the next thing you want to do is prepare a folder or portfolio of all of the important medical information that your doctor, especially when you visit for the first time, may not have at the moment. So that may include your prescription and over-the-counter medications, any that you've previously taken or are especially currently taking, any herbal remedies or supplements that you are taking, any insurance information that they might need, which you probably will give at the receptionist's office, at the reception desk, but it's good for the doctor to have on hand anyway. Any contact information for other doctors, current and prior, especially the prior, because that leads us to our next important piece of medical information, your medical record. If they, especially if you're seeing this new doctor for the first time, they may, if you don't have if they don't have your medical record on hand, they may give you a form to sign that lets you authorize that which you authorize to let them access it. So that's how that works. If you do bring a folder, definitely make copies of all these so that it's not just your only copy. You can have copies to give to just the doctor, and then all that you keep for yourself. And so when you're planning a visit and you know that you're not going to remember a lot of the stuff that the doctor's telling you, or that you may need help overcoming a language barrier, plan ahead to bring a family member, a friend, or request an interpreter to take notes and remind you of what to ask, because it you could get a lot of information at once and it might be hard for you to follow. So having help helps. That's what I'm essentially saying. And part of preparing the visit is actually going into a database and researching whatever concern that you have for yourself. So I actually have a really neat visual over here that I wanted to show off. It's a screenshot of prescription abbreviations decoded. So you might be wondering, when the doctor gives you a prescription, whether what certain symbols on it mean, because doctors in addition to all their medical lingo that they use, they also use a lot of abbreviations because they're really rushed half the time. So when they give you a prescription to give to the pharmacy, a lot of this abbreviations might be on it. So in the interest of curiosity, or to prepare yourself to be able to interpret what the doctor's written on your prescription, it might behoove you to look into these and kind of familiarize yourself with these abbreviations. So aside from just that really specific example, to create a more productive dialogue with your doctor, you want to educate yourself beforehand with reliable sources and studies. Because, like I said in my disclaimer, your doctor will have the final say in terms of your medical care, but it does not hurt to start a discussion of what you found and what they know from just being a professional. So I am again plugging in Medline Plus, my favorite database, because that is my go-to when patrons come to me to help look for information on a diagnosis, a medication, a surgery that's upcoming. I tell them I go to Medline Plus and I look up medical tests that their doctor has told them they need to get, what type of medication they were prescribed and what the side effects of that medication are, as well as what condition they are concerned about and are going to the visit for. So just to show you quickly, Medline Plus, it's the same kind of layout as the directories page, but it's just as simple. So you can either look through the topics A to Z. You got body location systems. You can look through conditions there. We have conditions and disorders specific, like cancers, infections, demographic groups, men, children, women, health and wellness for disaster, personal health issues, food and nutrition, just all sorts of stuff. For instance, if you wanted to look up if your doctor's told you, oh, you have high blood pressure, if you don't know that much about it, you can go to health topics, look under blood, heart, and circulation. And we're going to look up arteries, and high blood pressure would be under arteries. And here you go. There's a whole page dedicated to just high blood pressure. I go over this more in my previous webinar, and I will be doing another Medline Plus webinar at some point in the future. So stay tuned for that. And if you don't, and I know we all lead pretty busy lives, so if you don't have time to look up resources on your own, definitely consult a medical or consumer health librarian, such as myself, in your area. Greenwich is actually fortunate enough to have two consumer health librarians in the area. Myself and Sandra Chen, she works at Greenwich Public Library, and she's very good at what she does. So consider yourselves lucky that there's so much help available. So you've found the doctor that you want, made the appointment, you're now either sitting in the waiting room, you've done sitting in the waiting room, you finally get called up to go to the room with the metal table, and you're going to sit there, wait for the doctor to arrive. And when he or she does, it's really important. The very first thing that I think should be emphasized is to be prepared to be as honest as you can about yourself. Obviously, you'll go through the introductions, talk about the weather maybe, but be prepared to be as honest as you can about your habits as a patient. This is especially important to lay out when you first meet them. We might want to impress our doctors by saying that, oh, we exercise so much, or we don't drink this much alcohol, or we don't smoke this much a week. We're the most healthiest person ever. But that's not a very good precedent to set, especially since your doctor does not know you yet and they want to provide you with the best medical care possible. So you definitely want to be as honest about yourself and how you go about your daily life with your doctor. This may be the case from the first day or maybe from the 50th visit that you've had with them. If you are consistently feeling rushed, worried, or uncomfortable in their presence, you must let them know about it. But if they continue to do so, definitely you are not under no obligation to stay with them. But you should definitely make them aware that if you're not understanding something that they're saying, this again, we're talking about miscommunication here. We want to avoid that. So make them aware that you just want them to repeat something. If there are any symptoms or problems you may be having, you must make them aware, no matter how sensitive or awkward they may be. And I'm not just talking about, a symptom like, oh, I have an overactive bladder. Some people might be embarrassed to admit that, but that might be a symptom that you must tell your doctor about for them to know what to prescribe you. Other problems may include you may not have the ability to drive to your visit. You might have car trouble, so it might be hard for you to make more consistent appointments. So they can find other options for you, or maybe there's a public access vehicle that may be sent to you, or telehealth options. You may have issues regarding family members. Somebody may not be able to help you follow up on a surgery, for instance, or not be able to help you get the medication that you need. These are all things that can be addressed and solved with your doctor as long as you present it to them from the beginning. And you have to, and this kind of goes back to the thing we talked about with habits. If you had not been following your medication schedule or their instructions, that's something that a doctor needs to know so that, again, they can address the issue and hopefully find a way to resolve it. And you guys can work on that together. So we might be tempted to just sit back and listen to a professional, be a professional, and get all the information we need from them. But if they're not addressing something that you're concerned about, it is very important for you to be proactive and ask questions if they're not answered already, such as if you're discussing treatment and prevention options, what other treatment options are there? Are there any support groups or community services area in my area that can help me, for instance? Oh, sorry. What are the risks associated with the treatment that you're telling me about? And how will making a change in my habits help me? For instance, if your doctor requires you to exercise more, tells you that that's going to be really important towards your health, that may be a little bit too vague for some people. So if you're not sure what he means by that, you could state something like, "Oh, what type of exercises should I be doing? What's the minimum number of time I should be devoting to working out more?" Just help narrow down and be as specific as possible, and that'll help you out in the long run. And when it specifically comes to discussing a diagnosis, say that you've had a test that and the results have come in, it's positive or it's negative, be sure to address with the doctor how it may impact your everyday life now that you have this condition, how this condition can be treated or managed. Is it permanent? And if so, is it going to impact me on a daily basis? Is this something that can be managed easily or not so easily? And if this is a condition that you need to be managed with medication, what does each medication do? And what is the test that's used to diagnose this for? For instance, you want to be sure that that diagnosis is accurate and is for you and not for someone mixed up with somebody else's. So that's definitely important because the doctor might come in, have the paperwork, and just read off exactly what it says just to save on time. But you want to be sure, you want to advocate for yourself. Again, patient advocacy, that's number one priority. Be able to understand fully what the diagnosis is, how it impacts your life, can it be treated, and how will it be treated? What will each medication do? So I threw a lot of example questions at you, but if you don't want to be overwhelmed during the visit trying to remember all these questions, the National Patient Safety Foundation has outlined with this very helpful visual of that is I screenshotted that every time you talk with a healthcare provider, think of these overall broad questions. Number one, what is my main problem? Number two, what do I need to do to address this problem? And number three, why is it important for me to do this? So it just addresses everything that we already talked about when it comes to advocating and understanding exactly what the doctor is telling you. It's just asking it's basically clarification questions, which is really important to make sure that your visit was as productive as possible and that you're more likely to follow through on what the doctor told you to do when you understand the full scope. So it's keeping these questions in mind. It might be a lot easier than just having a full list, bringing in a full list or trying to remember a full list of them the day of. So there might be cases where you are not at the traditional hospital visit. For instance, you might be hospitalized prior to surgery, or you may need to make a telehealth visit. So by going on the phone through a patient portal, through Zoom, the like. So first, we're going to start with if you're hospitalized, you must find the surgeon. Get to know the surgeon who will be performing the procedure on you. Make sure that they go over what exactly will be done during this procedure, what kind of problems or risks may occur, and what is the recovery process, as well as how long will it actually take. So this is definitely something that should be gone over beforehand thoroughly, but definitely if you're hospitalized, you definitely want to go over it right before surgery. And if you're staying there, if you're there pre-surgery, staying there overnight or for a period of days, you might want to inquire. If you can't get a hold of the doctor or the surgeon right away, you can inquire with the medical staff that's on hand who come in to check on you and give you medication and who prep you about the daily routine of the hospital, because the doctors are probably going back and forth from other patients throughout the hospital. So they might be able to tell you when the doctor will be available and also when your family can visit post-op. So with everything going on with COVID, I think everybody's pretty familiar at this point with telehealth visits. But if you have not set up a telehealth appointment and you find out that the clinic or doctor that you wish to see requires it, find out what patient portal or app you need to make an appointment. For Greenwich Hospital specifically, we use on the Yale New Haven Health System, we use something called MyChart. I won't go into detail about it now, but it is a patient portal where you can make appointments and make video conference calls to your primary care physician and be able to see your results for any tests. I will have a MyChart tutorial. That's another webinar that I'm doing on November 10th. It'll be, I believe, at 6:30 p.m., but definitely tune in if you're not very certain about how it works or you've never had a telehealth visit before, because we'll definitely be going into more detail about this specific situation in that webinar. So definitely go into the events page at greenwichhospital.org. Definitely register for the MyChart tutorial if that's of interest. That patron's number one problem when it comes to having me describe or help them out with MyChart has been to know all their passwords and logins. They have the system itself is able to recover passwords that you're lost or you don't remember them, but it is really helpful while we're talking about logging in all your questions, logging in all your medications, all that important health info. Make sure to put in your passwords and logins somewhere safe so that you can just refer to it quickly when you need to make another appointment or see your results using a patient digital portal. These are just some last important tips that I couldn't figure out where to put. I just think like in general, either before or during a visit, these are applicable. So important thing is you should be patient, pun intended, with your doctor or healthcare provider. But like I believe I mentioned this before, if you don't feel obligated to continue if you are not satisfied. And what I mean by if you're not satisfied, you've addressed that you're uncomfortable or you feel rushed or you don't understand what they're saying. You've addressed this with them numerous times and they still have not changed or improved their behavior or rapport with you. Definitely do not feel like you have to stay with them. You are able to go back to the first step, go look at another doctor in your area that might be better suited for you for whatever reason. I would especially recommend this for patrons who tell me that they were recommended for a surgery as opposed to as their only treatment option. So when it comes to being recommended for surgery, always seek a second opinion. If that means having to go back to the directories and looking up another doctor and setting up another appointment, it's worth it to get a second opinion. So we talked a few slides back about when you're preparing for the visit, you gotta, educate yourself on the condition or the concern that you want to go into the visit for, such as with Medline Plus, the database that I love. So when educating yourself on a condition, medication, or diagnosis ahead of time, be wary of unreliable sites or scams that may pop up during your search if you're not just looking through Medline Plus. So I specialize in being able to evaluate websites, but if you'd like to learn how to do so yourself, there's a very helpful tutorial on my favorite database, Medline Plus. I promise this is the last time I will mention them in this webinar anyway. So this is what it looks like. It's basically just, you just keep clicking the pages and it just shows you, you can compare like a more between two websites and see which one's more reliable based on certain aspects of it. So you see there's these two websites, which one looks more reliable and what you should be referring to when you're looking up health information. Well, take this tutorial and you'll be able to find out. Or you can just come to me if that's easier. And the other thing I recommend for people to help bolster their evaluation skills is to use this checklist. It's called Trust or Trash It. And it basically highlights the 3 questions that you should guide you during the process of evaluating any health information you encounter. Because, oh my God, there have been so many myths about COVID-19. It's ridiculous. I mean, 5G causing COVID, really? And then just in general, just hydro how we went from like hydrochloroquine to convalescent plasmids. It's just when it comes to COVID, because it's so new, it's so hard to trust the news, or just because it's rapidly updating. What was an update last week is just considered old news now. It's constantly being updated. And there's definitely going to be people that take advantage of the lack of knowledge that the public has and try to sell you on wrong information. So, this is where tools like this really come in handy. Where the three questions that you may ask is who said it, when did they say it, and how do they know? And I like this checklist especially because it actually gives you examples. So, for instance, if you're talking about who said it, who wrote the information you're reading? Think about trusting it if the author's name is easy to find and the experience with the condition are respected in the community. Trash it if you don't know who wrote it or you can't find the author's name, you can't find information on the background of the author. So, very easy to follow. It's just anybody can pick this up and just use it when they're looking at a website that they're not familiar with when it comes to looking up specific condition or whatnot. So these are, I've mentioned some of them a lot during this presentation. So these are what I referred to when looking up these tips and providing you with an overview of what you can do to prepare for a doctor's visit. The first website was the Patient Safety Movement, which is a subset of the National Patient Safety Foundation. So as you can see here, they have resources for patients and families. They've got really handy resources such as infographics for medical errors, checklists for patient safety, fact sheets I would really recommend because they have things to know before surgery, opioid fact sheets, knowing the glossary of terms. And you can also order these or download these guides to help you during your stay. Just a lot of great resources that are free and available to patients such as yourself. The Agency for Healthcare Research and Quality, I've mentioned them before. They're the ones that did the question builder, the one that helps you create the questions that you want to bring to your appointment. So this is also the site where it would be at. It's right down here, but it also has 20 tips to help with prevent medical errors. They not only have things for patients, they also have stuff for hospital staff. But down here, if you scroll all the way down to patients and families in medical office, the list of questions, you can just click here. And this is just going over what we've talked about. What is this test for? How many times have you done this? Why do I need this procedure? Just while you're building your questions or trying to figure out what exactly you want to talk about, this is a great resource to find example questions and figure out how to formulate them. Oh, I said that I wouldn't mention this again, but yep, Medline Plus. As always, my number one go-to for health information. They have a wealth of knowledge on health literacy. And in their health check tools, they have a whole section dedicated to health literacy or health screenings. They do have the question builder, the link to the question builder 3 times here, just to emphasize it even more. So, and then like I showed you earlier, they do have the evaluating health information tutorial. The way that you access is you go to videos and tools, and it'll be just on the right here. And they also have a really handy tutorial about understanding medical words. If you didn't want to pay a lot of money and spend a lot of time being a medical professional, but you wanted to know exactly what certain terms that they use mean, or how they learn about what the parts of the body are, or the Latin root of each, what the Latin root of each condition means, that it actually has a really handy tutorial right here. It's actually really fascinating. And I sort of feel like I'm cheating the system by learning what a medical person learns, but not having to pay a ton of money to do so. So I recommend this as well. So, thank you very much for attending, those of you who are able to attend. If not, this video recording will be on my website, the Dr. Stephen Mickley Community Health Resource section. If you just Google that, you'll be able to find it. It's the first link usually. And here you just have my contact information in case you have any questions or want to see me to help formulate your questions or formulate your knowledge of the condition you want to address at your next doctor's appointment. There's my phone, my email. I'm open to both virtual or in-person appointments from 9 a.m. to 4 p.m. on weekdays, Monday through Friday. And like I mentioned earlier, I will be having a MyChart tutorial the first Wednesday in November. That's November 10th. And you will be able to register for that and more upcoming webinars from the Greenwich Hospital Medical Library at www.greenwichhospital.org/events or by calling the number below. So this is where I would normally be taking questions, but I think we are just going to wrap up for the night. So this is where I'll end. So thank you very much, Mark, for the audio visual help. And I will just say have a great night.